Well, as of January 1st, pharmacists in Ontario will be allowed to prescribe medication for 13 minor ailments like cold sores, tick bites, dermatitis, as well as uncomplicated urinary tract infections. The move is aimed at making healthcare more sustainable and accessible. Purya Sarmadi joins me now, co-founder and CEO of MedMe Health. Great to have you here on CTV News Channel.
Thanks for having me, Angie.
So talk to me about how this is going to help. There has been a huge burden on doctors and on hospitals. How is the ability to allow pharmacists now to add this now to their practice to be able to prescribe some of these medications?
Yep, so this is an exciting change. I think one of the big things that we saw from COVID was how the pharmacy networks across our country are really there to support first line access to care. We saw that with the vaccinations and the testing. And now with these minor ailments in Ontario, we're going to be empowering pharmacists to use their expertise to assess and treat these minor ailments and help patients to get care sooner and closer to home.
Do you think
But the benefits go...
Oh, go ahead.
Sorry, go ahead. Well, and the benefits go further. This is going to reduce demand in hospitals, emergency departments, walk-in clinics, and on family physicians. And it also frees up the time of the healthcare partners of pharmacists to allow those doctors, nurses, and other healthcare providers to focus on the more complex care cases that patients need.
Do you think this should have been implemented sooner then? At least, we're looking at now really 3 years of where we've been really seeing the healthcare system reeling. It had before that. But should this have been implemented sooner?
I don't know the answer to that, but we know that we've seen evidence from other jurisdictions. Provinces like Alberta and Nova Scotia have had legislation like this, to name a few, and we've seen it in other countries as well. And so it's just encouraging to see that coming to Ontario now, and for the public to be able to have an alternative. And obviously this isn't mandated. It's obviously just more optionality and access for patients to get faster and more convenient care.
Certainly, as you say, the accessibility and sustainability for patients, for pharmacists, or I guess new ones that are coming into the field. Do you think there will need to be or should be then the added education or whatnot as this level of responsibility, this higher level of responsibility is added to their practice? How do you think that is going to change, though, for now soon-to-be pharmacists?
Yeah, so I think the exciting thing here is that over the last 5 to 10 years, pharmacist education has been evolving. So pharmacists in their PharmD programs have been educated on this kind of clinical care, and often it goes far beyond just these minor ailments. But to see that coming into practice in the community is very exciting. And so what we would like to do as being a technology partner of pharmacies is enable that convenience, that integration in their workflow to allow the pharmacists to really practice at the height of their scope of practice and offer that kind of access to care to their communities and the patients that rely on it.
Certainly an important move forward, at least for the province of Ontario. Purya, thank you so much for giving us your time. Appreciate it. Purya Sarmadi is the co-founder and CEO of MedMe Health. Thanks again.
Thanks very much. Happy holidays.
You as well.